scoping literature review, initially focused on 5 countries, 3 in West Africa and 2 in East and Central Africa. But out of interest, I decided to expand it to the remaining West African countries. And then also, as I said, globally, the major donors are pulling out. So there's a lot of evaluations and going on to see how sustainable these interventions are. So this is a short word on the methodology, primary research papers, and then of course document reviews, websites, and then a few contacts of peers to verify the situation in the various countries. And what are the main findings? I hope this is readable. These are the countries in West Africa, and then these are the 3 comparator countries that took in East and Central Africa. And out of 15 countries in West Africa, we have 14 who are implementing performance-based financing programs. Ongoing implementation as of July 2019, you can see that these first 3 countries are at the conceptual stage. They're still designing programs, whereas these 2 countries are at the pilot stage. And then the vast majority of countries are in the subnational, some scale that is going on at the subnational level. Very interestingly, the last 3 countries here, they started, some of them even reached national scale, and then they discontinued. Immediately the donor pulled out, the program collapsed. So we hope that these countries here will not transit this way. This is why we're looking at this study. And then on the other hand, you look at some comparator countries. Yes, they have ongoing implementation at the national level. And then, most interestingly, Cameroon had reached national level scale up this year, moving progressively from strength to strength. And here you can see everybody received donor support, but in terms of domestic resources, no West African country is contributing significantly. And look at the strong programs they're receiving domestic support. In 2016, we know that 52% of the PBF national program was supported by the MOH in Burundi. Now, in terms of scale-up, Schroff et al., he has identified various stages that programs can be scaled up. Generation of evidence, through pilot projects. Adoption, when the pilot project is transformed into a program. And then institutionalization, when it becomes part of the policy, the National Health Financing Strategy, existing legislation, public financial management. And then when it is expanded to cover the system in all levels, central level, district level, regional level. The colleague from Malawi talked about the challenges of moving down the system and across the system. And then you can see where we are in terms of West African countries. 2 are at the pilot stage, and then most 12 are at the program level. In other words, they've not been institutionalized. The PBF is not mentioned in the National Health Financial Strategy, it's not in the public financial management system. No wonder they're discontinuing programs. And then look at Cameroon and Burkina Faso. Cameroon, Burundi, and Rwanda. It is actually a continuum. It's not really fixed lines in real life, but that's the purpose of this arrow, to show you that countries are shifting. But only Rwanda is clearly at the expansion stage where it has really permeated the system. Now, in terms of, are we saying, now there is, we can go deeper why this is so. Why have they not taken root? And there are many frameworks. Johnson et al. Has described a framework where you look at those factors that permit a program, public health programs, to move towards sustainability. For instance, they talked of capacity building activities. You must have endogenous resources. You must have, champions, and so on. And then it also talks of intentional activities that should be built from the beginning to move towards sustainability. Put in place process of evaluations to take corrective actions early. Impact evaluations to talk to stakeholders, Ministry of Finance, ministers, Parliament, etc. We've talked about sustainability in many programs, IMCR, etc. It applies to all these programs. So we can go in depth into these countries to see why these programs have not really gone to scale significantly. But I just wanted to point out that in terms of sustainability, Chloe et al., they came up in 2004 with a matrix. It's very simple, which allows us to qualify the sustainability prospects of public health programs. Weak, medium, and high. Very simple. And the main criteria is whether programs are routinized, have really permeated the system and are delivered routinely, and then whether it is institutionalized. Is it in the health policy, and the guiding frameworks and the standards of the Ministry of Health, etc. Are funds allocated, and generally going by this categorization, all West African countries are deemed as weakly sustainable. And then those 3 comparator countries are talked about are, high in terms of sustainability, where the government has infused its own domestic resources, modified the public financial management architecture. The colleague from Malawi talked about that, and allocated domestic resources. But of course, PBF is not a magic bullet. It is, it is part of the whole universal health package concept. The colleagues from Kenya talked about, free healthcare, from my own understanding. And then the health insurance is there. PBF is not a magic, but it's part of the mixed strategies for purchasing and financing. And we have seen that, like in Rwanda and Burundi, they have been able to combine it. Community-based health insurance. You talk to colleagues in Rwanda, they'll tell you that this is what is making the difference. It's not even the much acclaimed PBF that everybody is talking about across the world. Whereas in Burundi, PBF is also combined with exemption. Like in Kenya, you talked about exemptions, free care, etc. In Burundi, they've been able to marry the two together so that they are complementary. So this is where we should be moving to. And but unfortunately, as I showed you earlier on, we have this situation in West Africa, and we are still introducing new programs, conception, whereas programs have been discontinued abruptly because sustainability has not been built in from the onset. So we have to learn the lessons, have to be incorporated before we support a scale up in these new countries. Yes, this is what I'm talking about. Move towards reforms of ongoing interventions and institutionalization. Domestic resources, legal and public financial frameworks, they have to be modified to make sure that we gain the maximum benefit from PBF programs. And then for West Africa in particular, it is serious. For me, it is a call for action, because out of those 14 countries, 9 of them are in the top 20 under 5 mortality ranking in the world. So it is not a question, there's a lot of controversy about PBF. Should it be done, should it not be done? Is it standalone, is it integrated? There is enough room for all these strategies. PBF, free exemption, health insurance, there is enough work. The challenges are immense in the health system. We just have to find how to marry them together for effective results, especially in West Africa, where we have very unspeakable mortality burden. So I'll just stop here now. Thank you.